I am Dr. Carey. I am a pediatrician in Ventura, California, and we are talking baby care. Today I'd like to introduce my two guests who have joined me to share their child's experience with fever. This is Barbara, the mother of Gavr, an energetic little 2-year-old, and Yvonne, the mother of Harrison, who is 10 months old and about to become a handful. They start moving at that age. Welcome, everyone. Why don't we talk about what happened with fever for each of your children? Why don't we start with Gavr and what happened with him?
His last fever was pretty short-lived. He started getting kind of fussy at dinner and didn't want to eat, and we felt him, and he was pretty warm. I didn't really take his temperature though, because it's hard to do, and we got him to eat some frozen berries and a lot of liquid, and did our normal bedtime routine, and he did go to bed, but he woke up about an hour and a half later, and he seemed pretty uncomfortable. He seemed a little warmer, so I did give a dose of children's Motrin, and then he slept the rest of the night. He was pretty warm again the next day, and he seemed to feel a little better. He was playing, but he was still a little off, and we didn't medicate any more than that. I did kind of put a cool rag on his head a couple times when he would sit still. Mm-hmm. And he was better by the next day. He slept that night without any medication.
Perfect. What happened with Harrison?
His last fever, I got a phone call from his school, and they said his fever was over 100, so I went and I picked him up, brought him home, took his temperature, and it was 100.1. I put a cool rag on his head, I gave him some ibuprofen, just kind of kept him calm, gave him some food, he did eat. Then in the afternoon he slept a little bit, and then gave him a little bit more formula. He wasn't interested in any solid foods. And we gave him a cool bath that night, gave him some more medicine before bed, and he woke up maybe twice that night. The last fever lasted about 4 days. So throughout those 4 days, it was just kind of up and down, up and down. He would be okay for a little while, but once the fever broke, he would be cranky and kind of squirm a little bit. But it was, just kind of up and down of the temperature.
So we really talked about a few things here that really hit points of what I listen to when I hear what's going on. First, I think back to when you said it was too difficult to give medication. My daughter was a handful to give medication. Oh, she fought medicine. It was just impossible. And one night she was burning up. She was about 103 or 104 and refused anything. And we never gave anything because it wasn't worth the battle, and it comes down to fever generally is really harmless. And we get concerned about a number, and we tend to wonder what's low, medium, high. I have my own little definition of 100 to 101 I consider low grade, 102 to 103 is medium, and 104 and above is high. Fever is generally not dangerous though, no matter how high it goes. And technically if a fever gets above 106, 107, it can be dangerous, but by then most parents are running to the pediatrician anyway, so I tend not to be too concerned because I know they're going to seek the attention that they need. And then there were a couple of cooling methods that we talked about. We talked about giving medicine. We gave ibuprofen and acetaminophen, and then putting a cool rag on the head, and then bathing. And the main part with cooling with water to cool them down isn't so much putting them and submerging them in water, which is really not necessary all the time to help make them more comfortable and bring down the temperature, because the way cooling them with water works is when the water evaporates off our body, it helps to bring down the temperature. And you can actually use lukewarm or tepid water. It does not have to be cold water. In fact, they'll really be mad at you if you use cold water. I'd be mad at you if you were sponging me of cold water when I was ill. And when the water evaporates off our body, it comes down. In the old days, they used to rub people with rubbing alcohol, which is a really dangerous thing to do, which should not be done at all. But because it evaporates off the body fast, it really brought down the fever really quick. What was your biggest concern with the fever? How about for you?
Now that he's older, just disrupting his sleep.
Mm-hmm.
I like him to sleep all night. He
Right.
needs to sleep all night. when he was younger, it was always that question of, at what point do I medicate, and what point do I bring him in? And it was just, seizures scared me when he was younger, but we never had any problems.
Right. Were there anyone in the family who ever had a seizure from a fever?
No, but my brother-in-law was a paramedic, and he scared me with a few stories, so.
That was nice of him.
Yes.
Certainly any child under 2 months of age, no matter what the temperature is, really needs to seek medical attention right away. And I had a mom bring in a child once who was just a few weeks old, and she was just really fussier than usual. And mom said there was no fever at home, but by the time we got to the office and checked the temperature, the baby was running a fever. So really, in little ones, since they don't have many ways of telling you how they are, you really have to go by how they're acting and what they're doing. And this mom was really astute in noticing that her child was just not, and it was her first child, but she said, no, something's not quite right here, and came into the pediatrician, and the child had fever and a serious infection, ended up going into the hospital, but being okay, but needing to stay there for antibiotics for about 10 days. So there certainly are reasons why fever is concerning. What was your biggest concern with the fever for your child?
Just having the temperature go up too high, and just concerned on when to bring him in, exactly if I was doing things right. You know, you read about the seizures also.
Febrile seizures they're scary things to see. In just about all instances, they're completely harmless. There's usually a family history. When you start poking around, you'll find someone down the road who had them. They tend to have their peak incidence between 6 months of age and 6 years of age. Children tend to outgrow them. Most of children only have one. Sometimes they can have multiple. And almost never is medication for the seizure necessary for them. They usually last briefly. They're scary to watch. They go away. And in many instances, one doesn't even have to do further testing or blood work or anything for that child if it really looks like the fever itself is quite harmless. Once in a while, they become a little more significant, and the fevers can go on for quite a while, but that's not very typical. I would be concerned, again, for the little babies, if they're really crying and fussy and just seem out of whack. One of the items that you mentioned is that when your child's fever came down, he seemed to, how was he acting?
Normal. He was, you know, playing and laughing, but you could tell when the fever would go up again, and then when it would break, for sure. And
that's really what I like to see, is the fever come down for a little while, they get perky, you're thinking everything is wonderful, the fever goes back up, and then it comes down, and it's sort of this up and down. Fever tends to go about 2, 3, maybe 4 days, but as long as they're having periods of perkiness, I think that's really good. I'd be concerned if there were other things going on, especially for girls, if they had diarrhea recently or there's no other source. One needs to be wondering about whether there's a urinary tract infection or something like that going on. Is there coughing or something to suggest that there's a pneumonia? Do they have cough and cold symptoms, which maybe would point to an ear infection? So you really have to take a look at the whole picture of what's happening with the child, not just the fever. We worry about infections around the brain. We worry about meningitis, and sometimes something as simple as, if they're old enough, ask them to look down at their belly button, because if they can do that with their neck, they're not doing so bad. There is no clear sign of an infection that's around their brain. For little babies, I will lie them on a flat table and lift their head and see if I can get them to flex their neck at all. A child who truly has an infection around the brain, you can lift the head and the whole body will come up with it. They are not going to turn their head down no matter what. It's that uncomfortable. Fortunately, because of a lot of the vaccines that we're utilizing now, the Haemophilus influenza B, the pneumococcal vaccine, we're not seeing as much of this as we did. I've been in town for close to 15 years, and it was about once or twice a year that I would have a really ill child who would, I'd have to be concerned about meningitis in, and it's really been quite a few years since I've even had one now, which is nice. So we have made some headway. Breathing, I think that you really need to look at the breathing. I don't know if you've ever noticed, do you know how your child's breathing was when the fever went up?
This last time, no, but when he's had a higher fever, almost not quite panting, but the breathing got a little faster.
Mm-hmm. How about you?
Yeah, I noticed his breathing was a little bit faster.
And when the fever goes up, the heart rate will go up, they will start breathing faster, and when the fever comes down, the breathing should get better. But if the breathing seems to be increasing or more labored, they really seem to be huffing and puffing, then I would be concerned. Sometimes I'll just have a parent take the shirt off of their child and take a look at the chest and see if it's caving in, see if the child is really working hard to breathe. If it's exhausting to watch your child breathe, then they probably should be seen to know what's going on. And the other item that's really important are fluids. How did your child do with taking fluids or drinking while having a fever?
Very well. I mean, if I ever did have a problem, maybe when he was a little younger, just kind of forcing water into him, we'd just add a little bit of juice for flavor and he would suck it down. We never had to do Pedialyte or anything. And lots of fruits for the water too. He was happy.
Excellent, excellent. And your child?
He was okay with drinking his formula. I would give him spoonfuls of water or a bottle of water, but yeah, I didn't seem to, he didn't want to eat the solid food for sure, but the bottles he was okay with.
And there's really no reason not to continue with bottle or breastfeeding or whatever your child is normally taking. Usually the solid foods they're not interested in, but I'm really much less concerned about the solid foods than I am the liquid, because when the fever goes up, we're really starting to burn a lot of energy, and we're starting to lose a lot of heat, and then we're losing a lot of liquid in there, and that's really a big thing to watch for with any of them. How many wet diapers are we having? Are they just as heavy? Are they getting lighter? And what's going on? So the takeaway really is the activity level of your child. How are they doing? Are they looking around? Are they interacting? When the fever comes down, do they perk up? Do they wonder what's going on? Or are they completely out of it all the time? That would be very worrisome. And then we talked a little bit about ways of bringing down fever by sponging them, and we talked about medications. One of the patterns which is used by some people, which I really am not a fan of, is alternating medications. I don't know if either of you have ever heard about that, or
Heard of it, never done it.
Never done it.
Yeah.
Okay, it's because I probably said don't alternate medications. And the real concern is giving too much medication. Some people will give Tylenol or acetaminophen, and then they will give Advil, Motrin, or ibuprofen, and they will do one every 4 hours and the other every 6 hours. And it's easy to make a mistake. It's easy to give too much. These are medications that can damage the liver, that can be really harmful, and one really needs to be careful about that. So if the fever is going on for too long, it's really important to see the pediatrician and see what's going on, and avoid giving alternating medications, and also look at your baby and see if there are funny rashes on your baby, because if there are, they probably need to be evaluated right away. And that's fever. I thank my guests for sharing their experiences with us. I'm Dr. Carey, and I thank you for watching. For more baby care education and to sign up for our free newsletter, please go to www.drcareys.com, where at Dr. Carey's we teach baby care.
Breathe in, breathe out. Breathe in, breathe out. Okay, let me see your ear.